Okay, well, thank you and good afternoon. Thank you to Eric and really the entire association for allowing a former East Coaster to always come back and interact with other adult educators on the East Coast, even though I'm on the West Coast now. This is meant to be a session that can follow up on some of the ideas that I spoke about at the workshop at the previous spring conference about the role of community partnerships in our work as adult educators, particularly in the domain of health literacy. But if you weren't at that session, I also will recap some of the themes that were in that session so that we can all get up to speed. And here's what I plan on doing in the next hour. I just want to get a sense of who you are. Really briefly, I'd like to know a little bit more about your teaching context and what hot topics are on your minds and your students' minds regarding health care and the healthcare system. By way of just providing a sense of the scope of where we might be heading in this intersection of adult ed and health literacy, I'm going to show some results from a survey that I conducted here in California, but I think provides a glimpse of some of the issues and opportunities we have as adult educators as it intersects with the healthcare system in our work. I'll talk a little bit about how I see the role of adult educators, and this has been informed by work I've been doing over the past decade, predominantly with adult ESL teachers, and thinking of ways that we can think about our everyday work in classrooms in important ways and bringing greater visibility to that work. Part of my life, I spend about 40% of my life in public health. I do not have a public health background, but over the years, I feel that I've needed to develop a new vocabulary for thinking and talking about what happens in classrooms to be able to work with public health professionals and even health educators. And I'd like to share some insights on that point. And then hopefully by the end, I'd like to give you some opportunity to think about some steps you can take in your own programs. So with that, I'm wondering, Eric, if we can just open up some sort of poll for people to chime in. I'd like to know how many folks out there teach in any of these areas as a primary context, just so I know the scope of who's on the call. And then if you can identify what's a hot topic, what's a healthcare issue that is of greatest concern right now to your adult learners. And it could be informed by something you know firsthand or something that you have a sense of given your experience working in the program.
Okay, so you don't have to put your name in because I'll see it from the name on the question as it's coming in. But if you can identify where you are teaching and what sort of hot topic it will be, and then I can share it with Maricel. So Renee teaches ESL, and one of the things that she says is a hot topic is the students' ability to find a full-time job so that they can obtain insurance.
Okay.
Thomas is saying that he works in, and Renee says that that's not easy, and certainly I think that's the case. Thomas works in work readiness, and childcare is a big issue when it relates to healthcare issues.
Mm-hmm.
Lately I've been working with some undocumented students, and I think the health and how they interface with the health insurance system is really, really difficult and really, really crucial to kind of work through.
Mm-hmm.
Okay, other folks that kind of hot topic issues that your students may be dealing with, and you can add a second one or a third one if it's really something you like to share. Okay, so Catherine's saying that she taught ESL health for kind of a year and a half, but she's program the director now, so she's not sure what the tutors are hearing. But maybe that's a question that she's going to be able to ask her tutors to kind of see what's going on now.
Mm-hmm.
I think certainly the potential repeal of the Affordable Health Care Act is going to throw things up in the air too. Phyllis says that she works with the welfare to work population and that access to mental health is a great concern.
Great. That gives me definitely a flavoring of some of the range of concerns that are out there. And also, I think it's not surprising that some of the issues that you address aren't necessarily zeroing in on, let's talk about cancer prevention, let's talk about vaccinations, let's talk about these health specific domains where although we know those may be issues for our students, a lot of the concerns that we have as teachers often have to do with our students' ability to navigate across systems. So this idea of how do I get health care, how do I keep health care, health insurance, as it interfaces with my opportunity to have a job. I mean, that certainly speaks to how adult ed, workforce training, and health outcomes are all very much interrelated. And I think it's unclear about the kinds of discussions we're going to be able to have in the next administration, but at least up until now, in the past few years, there's been some openings for those kinds of conversations to happen at the policy level. It remains to be seen what kind of conversations we'll be having in the next 4 years. Let me bring you to a teacher survey that I think some of the concerns and opportunities and experiences you have had may resonate with what these teachers told me back in spring 2010. At the time, I was working with a statewide initiative called the California Diabetes Program. As you can tell from the title, the preventive health content that we were particularly interested in was the reduction of type 2 diabetes across the state, which is known nationally and at various state level data systems. We know that it travels very closely with high rates of poverty, low levels of education, and a lot of other at-risk factors. So as part of their outreach efforts, the California Diabetes Program said, let's work with the adult ed system. And because I was involved, we looked specifically at the ESL system. Our interest in doing the survey was just to gauge what is the level of teacher interest and readiness to be able to tackle something like diabetes prevention in their ESL teaching. And I'll say very quickly, you know, on the one hand, from a public health perspective, this is a very novel question to ask. It's a very novel approach for the public health field to reach across a different institutional boundary. But in many ways, these are concerns that we've had for decades in adult ed, and we know that health is one of very important concern among our students. We reached out to a lot of teachers across the state, very much through an organization like NJAW called CATISAL. And even though we did a very wide distribution, we got a very low turnout of 140 responses. And so bear that in mind as I show you some of these patterns. Not surprising, we had 94% of the teachers tell us they focused on health at least sometimes, so it's not an uncommon area of instruction. And here are some of their most common preventive health topics: nutrition, doctor's visits, physical activity and exercise, and I think Phyllis's earlier point about issues to access to mental wellness, there were one of the more recent areas that people wanted more information on was the emotional well-being, sources of stress and stress management. We also asked teachers how they felt it would be important to introduce health themes into their teaching. And when we asked them about pedagogy, a lot of them gravitated to phrases that speak to contextualized language instruction. So over 80% talked about needing to integrate real-life materials, such as real-life healthcare forms that the students were encountering in everyday life. 2/3 of the teachers felt that using students' own experiences through like students' testimonials or stories that they were writing or telling would be very important. And that nearly all teachers thought it was important that after teaching a particular unit, they wanted students to be able to connect what they had learned, their English skills, to real-life actions. And so I'm sure this might resonate with ways that you've already heard about the introduction of any kind of social issue, but in particular in health. This slide's probably going to resonate with you as well. We also asked them what might stand in the way. And you'll see as you look down this list, a lot of these are endemic in many areas of our adult ed programming. Teachers not having enough time, not enough flexibility. They can't get administrator approval for the creative work they want to do. They may not have appropriate materials, particularly if they're relying on existing preventive health brochures, for example, and that these would be inappropriate for very low-level learners. They felt that their own knowledge at times was inadequate to be able to tackle things like the Affordable Care Act, which is hard to understand even if you are highly proficient in English and can read well. Concerns about whether it's going to sustain learner interest and perhaps lead to students not wanting to come to class. Cross-cultural differences, not knowing how to talk about things like mental wellness issues that may have cultural sensitivity, and of course not wanting to feel like they were probing into learners' lives by having to introduce these health care concerns. I'd like to stop here and just to see, just to invite for a minute or so, which of these bullets resonate with you? Are there things you would add as you have thought about integrating health themes into your own teaching?
And again, you can either raise your hand and I can unmute you, or you can use the question area to chime in. Maricel, as people are typing, I think one of the things that really strikes me is the cross-cultural differences about food and health. You know, I feel like we have gotten better at thinking about that issue, but I don't know that if we have the content. You know, I feel like people rightly so are concerned about it, but I don't know if they feel like they have any more background than they did. So it's something that they're sensitive to, but maybe still not feel confident in dealing with some of those complications.
Yeah, and we can talk about cross-cultural differences along many wavelengths. You know, somebody who may not have the same opportunity to shop in the same kind of markets may just mean that people are bringing very different perspectives to the classroom. And I know from the ESL world that it's always, you know, for example, I've met parents who find it very hard to adhere to some of the guidelines that their pediatricians will tell them, because having lived in countries in Central America, they just feel so happy to be able to treat their children and give them snacks that they could never afford before. And so
Right.
there's just really interesting stories that mean that there's a lot of need for just opportunities to discuss what's challenging, rather than trying to begin from a place of here's what you should do and should not do, which I think complicates the discussion in the first place because of a lot of mixed messages.
Right. Phyllis chimes in saying that this idea of inadequate instructor knowledge is an issue. She agrees with that, and also concerns about learner privacy, which I think a lot of people would put it maybe at the top of the list of wanting to make sure that you don't violate learners' privacy. Anybody else with thoughts on this before we move forward, or if there's other issues you feel like would present themselves when you're trying to do a health outreach or health education effort, such as the one with diabetes prevention? Okay. You know, I think if you think of things, you can still write them in, and I can share them, but I think we'll let Maricel continue.
Okay. Well, I think one of the things we took away from this survey, which wasn't exactly earth-shattering, is that when you think about adult ESL educators, and I would extend this broadly to adult educators across many programming domains, is that we do have a very important professional workforce that is positioned in a very unique way, and it has an ability to reach out to many populations that the public health world also seeks to reach out to as well. And yet, because of the nature of our work, and often the ability to be able to ask questions in instructional environments as opposed to clinics, we are uniquely positioned to play a larger role than perhaps we've been given credit for. So I think very often when you do tap into the literature where they do talk about the role of adult literacy systems in public health, you kind of get these two lines of thinking that were important because, one, there is a strong, undeniable link between literacy levels and education levels and health outcomes. That almost to a merciless consequence level, that lower levels of education, lower rates of literacy travel very strongly with poor health outcomes. And of course, we can complicate that relationship by saying, well, low levels of education also travels with low levels of poverty. And is it poverty that's the determining factor that causes those those poor outcomes? Or is it all just a messy mix, that all these factors are important and all of these factors need attention? We don't really have time today to talk about that trend. It is a very real trend. It is in the backdrop of a lot of policy discussions. And I think as you, as an adult educator, walk into this conversation, it's important to understand that that is an unquestioned trend in much research that shapes the way people think about what we should be doing in our educational settings. And the expectation that when we teach literacy, good things are supposed to happen. And we're going to revisit that assumption in a few more slides. The other piece is that it's also not questioned and is widely recognized that our healthcare system demands a very diverse range of basic skills, that you need to be able to do basic math, read at a proficient level in order to be able to navigate our healthcare system. Some of that is very much aided by technology, but still in the way we ask people to interact with the healthcare system, basic skills are a requirement. So because of that, those needs, I think we are looked at as a place where those basic skills development can happen. And here's where I'd like to introduce some yes, but thoughts. And here they are. And this is where it gets complicated and where I think we need a lot more advocacy as adult educators to be able to slow down a conversation that's about 3 decades old, but has not really gained very much sophistication in the way we talk about literacy or skills education. So the first point is, let's talk about the way literacy is being defined in many of these views on literacy and its links to health. What do they mean by literacy? And as you'll see in the next few slides, why are we only thinking about literacy as reading? I think those of us who have taught reading know that far more is involved in the development of the skill than the decoding of words on a page or the development of a vocabulary base. But very often, in much of the health literacy work that's been happening in the last 3 decades, there's a reliance on thinking about literacy as reading and literacy as a finite set of skills that can be taught in schools. A second question is, as you think about how demanding our healthcare system is, a response has often been since the 1980s to simplify language. Okay, if language is the problem, let's simplify it so that we can improve comprehension and make information easier to digest. And we know study after study after study has shown that simplifying the language of health information is needed but not sufficient to make a real meaningful dent in health outcomes. I want to stop there because this is an important trying to hold 2 perspectives on a very large landscape in the US right now. And if anybody has any questions, I'll answer it quickly before moving on.
Well, Renee just chimed in saying how true this is, that sometimes or oftentimes the adult doesn't understand the forms that he or she must complete. And I think, I think one of the issues that you're pointing to, Maricel, is that making the documents more accessible is an important step, but how close does that get to allowing the learner to kind of transition from one form to another, to navigate across the system as a whole, and to make those connections to their life and the other decisions that they're making. I think
Absolutely.
And I think the part about literacy, I think, is really important. That we do often think of literacy as reading, but the whole reason that the field has gone towards that term is that it's supposed to be inclusive of writing as well. And I think that writing is often overlooked, not only kind of functionally or instrumentally, where you need to write letters to your doctor, you need to write letters to your health insurance company, but you can also write letters to deal with your health in other ways, and you can write it to deal with your health in other ways. So I think broadening a sense of what it means to be health literate or health literacy, I think, is essential.
And I would add to that that literacy involves not only reading, not only writing, but it also has to take into account the kind of talk that happens around what we read or write.
Right.
And very often, the significance of a document that is sitting in front of you, whether it be a child's report card during a parent-teacher conference or a form that you have to fill out to provide consent to your doctor, it's oftentimes, if you reflect on interactions you have, you're not filling out the form and discussing what's on the form. You're discussing the significance of the form. And that means that there's a greater burden on how you're able to converse with the doctor or with the teacher, rather than being able to simply understand what's on the document itself.
And the
And
process of filling it out is one of the key educational parts, right? So
absolutely.
working through it and talking to other people, the doctor, your family members, friends, walking through it and talking through it is a key educational part.
And in fact, that can garner you greater success in task completion than going in saying, oh, I can fill out a form and not be able to complete the task based on that skill alone. So this slide is just an echo of what we're already saying. I think the default view, and this slide I have to disclose definitely reflects my own biases and assumptions as a literacy researcher. A default view, both in education, although we seem to be coming around, but definitely in this health literacy world, is that being literate has to do with the skills you have. And there's an emphasis on a set of reading and writing skills independent of the context in which these skills are put to use. So reading and comprehending is basically the same if you're talking about child's vaccinations as it is if you're looking at cancer treatments. It pretty much is the same, and we can teach them as such. And that's in contrast to a much more neglected view in health literacy. And in fact, it's people in Australia and England and Canada that have advanced this view, not the US researchers in health literacy, where doing literacy has more to do with a set of practices, focusing on what people do with those skills, the activities and purposes that make language use meaningful process in our everyday lives. And in this sense, how do you use your reading, writing, speaking skills to get healthcare tasks successfully completed?
The example of this Marissa, the example that I give of this often is thinking about medicine bottles and labels, right? And so if the label says take 2 pills 3 times a day, right? One way for us to assess someone's literacy skills around their health would be if they take those 2 pills 3 times a day. But the reality is that many people find themselves in a situation where they can't refill their prescriptions before the prescription itself has run out, right? And so then they're in the position of saying, well, if I take 2 pills 3 times a day, I'm going to run out. So do I take 2 pills twice a day? Do I take 1 pill 3 times a day? So these are the types of practices, these are the types of critical thinking and critical choices that people have to make that wouldn't be captured by thinking about literacy and comprehension strictly from a literal point of view.
And what further supports kind of that anecdote, Eric, is there have been so many studies that have looked at, let's simplify prescription labels and prescription instructions so that adults on their own can pick up their prescriptions, maybe after just a basic conversation with a pharmacist, they can go home and take their prescriptions accurately and safely. Study after study and study after showed, one very popular study was conducted with Target labels at the Target store, has shown no meaningful impact on whether or not people are successfully able to manage their prescriptions better, even with a simplified label and a plainer language set of instructions. So again, to go back to my earlier point, it's not that those adjustments aren't needed, it's that they're insufficient, and perhaps it's because we haven't looked at the practices, just as you're describing, Eric, that we're missing out on other ways that we could be boosting people's ability to complete those tasks successfully. I want to just call attention to this wonderful researcher who I started reading her work about 12 years ago, and I had an opportunity to work with her recently. She is by training a sociolinguist, and I wanted you to alert you to her website, which is a very reader-friendly blog. Christina makes this wonderful point that I think we should be using a mantle in our field, which is that she regrets that public health 3 decades ago chose to use the word literacy at all when they were trying to come up with this idea of health literacy. How do people make sense of information in health? That it was unfortunate that the word literacy was chosen because of its associations with undereducated, low-skilled, unintelligent, and a very narrow attention to reading. And we have not been able to shake off that reputation, which I think has very much stymied our efforts and the links to adult ed. There's been far too much focus in development efforts on just improving reading and clear language efforts. And she has argued multiple times that it's important but not necessary to improve access to quality health care. You can go on her website and she shows you multiple examples of how clear language is never clearer and simplified language is never simple. And she's wonderful examples such as, how Zika virus mosquito pamphlets got distributed, and complicated things, and sometimes we're able to clarify things. One of the points that she often reminds us of, let's think about what we mean when we say health, when we try to unpack this word of health literacy. And I think of our learners when I think of this definition, that health is defined as a state of complete physical, social, and mental well-being. It is not the absence of disease or illness. Whereas often I think the rhetoric in both of our fields tends to treat health as a risk factor for our learners. We are less likely to think of health as being a resource for decision making, not just the end goal. And as I just noted, that this word literacy and its narrow interpretations has really been complicating our conversations and limiting in many important ways. We know that reading and writing skills has been the prevailing way of talking about literacy, but there are all these other ways. There's reading and writing practices. We can think about somebody's individual skills, but we can also talk about how you are sometimes more skilled in your literacy repertoire if you work with others. There's lots of interesting work out there about how literacy is actually a social achievement, not just an individual one. There's also connections to identity. In the sense that we know this far too well in adult ed, that how well you read and write and the languages you are allowed to read and write and demonstrate proficiency often have very much to do with who and how you are viewed in the world. Literacy is being tied to social action. What do I want to do with my reading, writing skills? How can I use this to express things that I care about? I think that's something that your professional organization is quite exemplary with, in fact, in working with its learner leaders. This is I just wanted to quickly share this graphic from Dr. Christina Zarcadoolas' webpage, just to remind us of this idea that the simplicity argument has become a detriment, because I think for our work as adult educators, for people who never step into our classrooms, they think what we're doing is trying to make things accessible and more simple. And that's not what we're doing in adult education and in many adult learning environments. What we're doing is enabling learners to handle the complexity that's there and always will be there, because healthcare is complex. Are there questions popping up, Eric, or can I keep going?
I think you can keep going at this point.
Okay. So I wanted to just revisit that earlier slide to reframe what we need to be doing and why we're important in determining health outcomes. And I frame this slide by saying, I don't know if qualified teachers should be doing anything differently than they're already doing, but at the very minimum, more visibility to what we do needs to be advanced. The first thing we can do is we can educate others about the nature of literacy and numeracy. We're battling 3 decades of, quite frankly, ignorance about what literacy actually is. Specifically, as one example, what is the relationship between reading, writing, and speaking? We can also advance understanding about how new skills and practices are developed in context, just as Eric's example showed earlier, how people's actual decision-making powers, how their daily schedules force them to interpret what to do with a particular medication, shows that there's a very important contextualization of how skills are successfully deployed. We can remind others, I find this is very important for ESL teachers, we can remind others that proficiency is not equivalent to success. Even the folks with higher proficiency can struggle with the navigation of information systems. And also we can think about our work in this area as changing the way that our learners can participate in their own healthcare decisions, not just that they can be better comprehenders of the information that they are given, but that they can direct conversations, ask questions, and participate more fully in their own healthcare choices. I want to stop for a moment and give you an opportunity to think about how you analyze the healthcare system for opportunities for teaching and learning in your own classroom. So I show you this photograph, and I'd like to ask you to chime in to say, thinking about this pharmaceutical context, you're getting a drug, you're having an interaction with a provider, you may or may not have questions about how to use this drug effectively. What are skills that we teach, whether they be literacy or numeracy? What are the things that we address in our classroom that would prepare learners for this kind of interaction in the real world?
Okay, and again, you can use the question area to share some of your ideas. This is, Maricel, I always say this is the hardest part of the webinar. The giving ample wait time in the classroom is one thing because you can see your students thinking and working. And in the webinar wait time is a little bit more difficult. So we have to be, I think, as part of our mental health, I think we need to be more comfortable with silence sometimes.
Absolutely. Yeah, we should have like little kitties walking across the screen to distract us while we're waiting.
I mean, one of the things that really comes to my mind when looking at this photo or kind of thinking about people's interactions with doctors or pharmacists is the ability to ask clarifying questions, so that when you're getting instructions about the medicine, about side effects, about the benefits, that you know how to ask the kinds of questions that will help you understand the decisions that you're going to make around that medicine. And I think this is certainly not isolated to learners that might find themselves in adult education programs, but I think it's essential for people who might have feelings of low self-efficacy when it comes to these types of interactions, that they feel confident in asking those kinds of clarification questions.
so that a question can even be asked more fundamentally, and then what kinds of questions are worth asking. And even if I can't think of a question, is this a kind of interaction that will help me discover questions that I could be asking?
Right. And I think that's part of advocating for yourself in multiple ways. Phyllis notes that following instructions is part of it, and measurement and dosage is part of it.
Eric, I didn't hear the first one. It was a little garbled. Measurement, dosage. What was the first one?
Following instructions or following directions.
Okay.
The other thing that one thing that we often talk about in kind of our literacy classes is the benefits. All right, so my audio is not very good, so I'm going to change my audio. All right, so hopefully that makes the audio a little bit better.
Oh, that's better. Yeah, okay. You were sounding like you were in a fishbowl.
Okay. One of the things that I often talk about in my classes with students is the benefits of rereading, right? And that I think people often think that people who are struggling with reading are the people that reread, and they don't think that experienced or confident readers reread. But I think that is an essential part of dealing with medicine and the healthcare system, that making sure that you really understand what it is that you're getting into and what you're supposed to expect, so that you're willing to go back and reread the label, reread the side effects that they give you as a handout, and kind of thinking about those practical strategies when it comes to reading.
Mm-hmm.
As well as the kind of general cost benefit ratio, right? Like, what's the potential side effect of this drug, and what's the promised benefit? So
sure.
I'm not going to take it just because somebody told me to take it. I really want to understand why I'm taking this medicine, and if there are other options. I don't think anybody else is chiming in yet, so I think you can move forward.
What I'm trying to work towards is a broader framework for thinking about the different ways we think about teaching health literacy. And a researcher by the name of Don Nutbeam from Australia breaks down health literacy in 3 domains. And just listening to some of the examples that you and Phyllis offered, we can see how the work we do in adult education classrooms can fit in any of these 3 buckets. Aspects of functional health literacy has to do with literacy and numeracy in context, being used to complete a particular purpose. So measurement, dosage, following instructions, those are skills, those are numeracy skills and literacy skills that we would be able to teach, so that our learners would be able to properly determine dosage, properly mete out a dosage of medicine, and be able to follow instructions safely. The points that you're bringing up, Eric, where you're asking clarifying questions, asking for time to reread something so that you can clarify your understanding, falls more in the latter 2 areas, where interactive health literacy is having to communicate with various individuals in the healthcare context. Critical health literacy has to do when the information fails you, when you don't understand it, when you don't agree with it, when it doesn't jive with your expectations, where you really do need to advocate for yourself and demonstrate some self-efficacy. So I think we probably do this stuff all the time in our adult ed classrooms, but I think it's very helpful to think about to what end are those skills being taught. Eric, did you want to comment before I move on? Because you brought up some of those examples that fit quite nicely in the latter 2 bullets.
No, that's okay. I think you can elaborate on them as you move forward.
So, great. So I think, as we think about this framework, holding on to, there are things that we teach that that are decontextualized skills that we like to show our students have a particular purpose in healthcare, and that through role plays, we often rehearse our students so that they are able to communicate and interact in the healthcare system. But it's that third bullet that I think is so powerful. And when the knowledge breaks down, when the knowledge is insufficient, when your best strategies don't work, your best clarifying questions don't work, what do you do? How do you keep yourself an active participant? I think is where we think, how are we promoting that self-efficacy in this healthcare domain? As I have thought about how we think about our work in classrooms, I mentioned earlier that I felt there's a need for a better vocabulary, so that when we are talking about lesson plans, interaction, practice opportunities to practice language skills, that those kinds of pedagogical terms resonate with the people we're trying to work with in public health. And this is a framework that I did share at in New Jersey this past spring. But these three words, reach, engagement, are tools, may seem very familiar to you, but they have very specific meanings in public health that I think are very useful for interpreting what we do in programs. And then these become starting points for conversation if you were to find yourself working with a community partner in healthcare. So one thing is to think about the reach of your classroom. What kinds of students are coming to your classrooms, and how does this give you a particular kind of reach into a public health domain? I'm thinking of Eric's point earlier, when you have the opportunity to work with undocumented learners who often have a very tenuous relationship with institutions, but often may have one of the most constant relationships they may have are with their educational program, and how this undocumented population represents one place where we have incredible reach because we are considered a trusted person within their network. I also think of the elder refugees, for example, who may travel together, migrate together, live together, and represent an important subpopulation that may or may not overlap with populations who go to clinics and hospitals. So we may think about attendance and participation and enrollment. That becomes encapsulated in this concept of reach in the public health world. We think about interaction, we think about participation, we think about what gets learners engaged in this new material. And that term is also something that can be used to spark public health conversations. What are ways that our materials motivate learners to figure out the healthcare system? What are ways that our materials promote engagement so that students are not only listening to information given to them from the teacher, but also learning from one another? And so thinking about how our classrooms provide social support so that classmates are able to share each other and provide a basis for peer pedagogy. And finally, we develop materials all the time. Curricular tools, lesson plans, lesson activities, tasks, that's the nature of our work. Public health is constantly looking for better outreach tools, better engagement tools. And so thinking beyond the brochure, thinking of ways that you can invite conversations about, well, how do you actually use this medication, and what are some tasks in the classroom that bring those kinds of practices to life? And the wonderful thing, and I think is very appealing to many of the public health professionals I've been lucky to work with, is they're rather enthralled with the idea that we're utilizing professionals already in place. And that's you, the adult educator. By doing your work, you're becoming part of a larger system that can be used for reach, engagement, and the dissemination of important interaction.
Okay, Marisol, we have just over 10 minutes or so.
Okay, great. Are there any questions here before I move into some action step slides?
I don't think so. I think it's okay.
Okay, great. So I wanted to just talk about steps that you may already be contemplating, but I'd love to hear before we close out this afternoon whether you're taking action in any of these two areas or others. So one area is harkening back to that earlier survey finding, in what ways are actual learners' experiences becoming the basis for health literacy work in your classrooms? And how are you harnessing those lived experiences, those stories in the work you do? And then another part is to, I'm going to suggest, is to think about how do you map your own network. And I want to think about mapping at the learner level as a way of thinking about what social supports they have that support their health literacy. Given that, by definition, many of the learners don't have sufficient numeracy and literacy skills to handle all these tasks on their own. So what are the social support systems that they use that enable them to complete tasks more successfully? I just want to give you a few examples of stories that have driven my work and enabled me to connect with members of the community. About 8 years ago, we did work in lead poisoning prevention in the Monterey area, where there were high rates of lead poisoning in the children, and they were trying to figure out where the sources of lead were coming from. They discovered that many of the sources of lead were coming from the clay pots and the candies and snacks that were being mailed from hometowns in Mexico to California. And the public health organizations in the area were concerned about having to tell local communities, you should not eat your traditional foods, you should not use your traditional pots. But they were at the same time very concerned about these high rates of lead. So we had stories collected from some of the local families, which generated ones like this. When I talk to my husband, I tell him, don't give our children food prepared in clay pots. It will harm them. And he says, what harm? We all grew up eating from clay pots. And this story sparked lots of conversations in ESL classrooms that enabled us to address many areas of health literacy. And so using that framework from before, this is an ESL setting, we're still able to both address the language and the vocabulary needed to be able to talk about lead poisoning, and that drills down to even the grammar that's needed. You'll see we needed to teach the past tense. It provided a meaningful context for teaching the present participle. We grew up eating that food, we grew up using that clay pot, we grew up bathing in that water, we grew up drinking that water, etc. Another important domain of functional health literacy is the vocabulary needed in order to talk about risk, given that lead is an unseen poison. Because there was a discussion in the story, we worked to strengthen interactive health literacy by placing learners in different role plays to talk to different individuals who might need a school teacher, a landlord, a spouse, a community leader, a business advocate, a store owner that sold candies, to provide them with a different perspectives around the issue. And then a critical area of critical health literacy was the self-efficacy you can develop at the group level by talking about lead as one of many unseen poisons, rather than stigmatizing the immigrants from Mexico as bringing lead into the Monterey area, enabled us to reduce the stigma and promote a sense of shared advocacy. So I don't know if we'll have time to do this, but I wanted to show you this story about a group of women in Oakland who were tired of standing on the sidelines watching their husbands play soccer and decided to come together and form their own soccer team. And this is part of a unit on the type 2 diabetes prevention about how exercise and being active requires social support in the community, and how many of our local communities, local adult learning communities, have that very much part of the lived fabric of their lives. So what I was going to ask you to do was to invite you to think of what are some functional areas of health literacy, interactive and critical, that you could use harnessing this story. But I'm not sure, I don't think we have time to do that, Eric, correct?
I don't think so.
So I'm going to end with this slide. well, actually, this slide and the next slide, to think about who's in your network. And I wanted to list individuals that I feel have become important players as you think about who can support health literacy work in the classroom. Um, there's an organization named Imprint. You can go to their website, and they have network mapping tools that you can use to discover who in your geographic area around your adult ed program would be interested in working with you to address some of these issues, so it's not your curriculum working solo. Adult learner leaders, community organizations, adult ed programs, libraries, schools, universities, that's how I get involved, faith-based organizations, ethnic media, resettlement agencies, and your own colleagues and friends. I skipped over local health literacy coordinators because, in fact, those are individuals who are relatively recently arrived on the scene. There are now more and more hospitals and clinics who have dedicated health literacy coordinators, and their job is to promote systems navigation. So that seems to, if you can find out who your local health literacy coordinators are, that's an inroad to collaboration as well. Let me just skip ahead to the end, to my final slide.
Actually, can you pause on that one? I think this is a good one for you to pause at. Can you just say something about this idea of as a shared resource?
Sure. So one of the ways hinted earlier about health literacy is trying to move away from health literacy as being an individual risk factor, low health literacy as an individual risk factor, and health literacy as an individual set of reading and writing skills. Moving more towards this idea that there are health literate systems, not individuals. It's the combination of what a provider is able to do, a teacher is able to do, various intermediary support systems can do, that enable someone to feel health literate. And I often think of this, people with the best insurance systems have a very strong health literate system, which requires you to understand very little about how your healthcare works. You just turn in your claims and it seems to take care of itself. When you don't have a strong healthcare system or an insurance system, you're required, ironically enough, to know more about how the system works. And you're required to navigate more. So I think it actually helps to think about what are the networks that our learners travel in that support, both create conditions where they have to think about healthcare, but also create conditions for them to practice new health literacy skills. And if we're not having conversations across community schools, workplaces, we won't find out where that mapping can happen. So I'm looking at the time, Eric. I want to be able to make sure people have an opportunity to ask questions about anything.
Sure. I think, why don't you just briefly introduce the links in the Open Door Collective, and then I think we can open it up.
Sure. So all these slides will be made available to you afterwards through Eric. I just wanted to make sure that if you're not already connected, this is a free discussion listserv that you can join through Links Community. I'm on it, and I think every week materials are shared, new opportunities to connect with both teachers and public health professionals. It's the constant source of that kind of networking. And then most recently, a group spearheaded by David Rosen in Boston called the Open Door Collective has written a paper called Why Healthy Communities Need Adult Basic Skills Education. And it's a 2-pager that's meant to be shared with policymakers, teachers, adult ed programmers, so that you have kind of a quick and easy overview of why adult ed matters in healthcare.
Great. So with the little bit of time we have left, I know we can probably go a few minutes over, but are there pressing questions or thoughts that people wanted to share? I'm particularly interested in, coming from the New Jersey Association for Lifelong Learning perspective, in thinking about the conference. Um, are there particular topics in a healthcare or health literacy, health education, ABE overlap type of session that you would like to see us pick up at the conference itself, or in other professional development opportunities? And Marisol, thanks very much for sharing your experience and your insight here. I think this is a type of workshop that has the lingering effect of trying to rethink our categories and rethink how we're approaching things, rather than simply like trying this strategy tomorrow. Although I think
Yeah.
you also provided
One thing I would mention, a few of you mentioned concerns about what's going to happen with the Affordable Care Act. There's a researcher down in Georgia, Don Rubin, who developed different posters and graphics so that people understood what's a deductible, what's a claim, to help adults with low basic skills be able to understand how healthcare insurance systems work. And he actually found many positive results. And I don't know if it's been fully tested in an adult ed situation. He was encountering things like learners thought that once Obama left office, they thought that their Obamacare would go away. So trying to get ahead of the curve is motivating a lot of his work in trying to help people gain a better sense of what insurance systems are all about.
They might not be wrong.
Yeah.
So are there pressing questions that you would like to ask, or insights you have to share? All right, thanks, Kathy. And then, as usual, I'll be sending out a certificate of completion. The PDF of the PowerPoint and the webinar itself will be archived up at our YouTube channel. And I haven't started working on the spring series of webinars yet. It may not start again until March or so. And as much as possible, I'm going to try to connect it to the work that's going on in the conference. Because one of the things that we know about teacher change and teacher development is the best way to promote teacher change is for teachers to get involved in collaborative projects in their schools and in their contexts. So for those of you that are particularly interested in health literacy, I would encourage you to kind of define your own learning projects and work with colleagues on developing new ways, new materials, new interfaces with your students and with the networks around you. All right. Thanks so much, Marisol. We'll talk to you
Thanks so much,
soon.
Eric.
Take care, everybody.